Hello, everybody.
Hi.
My name is Dr. Peter Megdal, and I'm so happy we got a crowd here today. We have a pretty intimate group, a small group, and I'm going to ask a couple of questions of the group. You can choose not to answer, but I'm just curious. I don't want to violate anybody's HIPAA rules violations, but I'm not a medical doctor, so I'm not sure it counts. You guys are not patients. But how many in here know somebody with heart disease? Almost everybody. And if I'm not too intrusive, if you don't want to answer, how many people have heart disease? Okay. So, so do I, or at least I used to. Now we're going to go through what cured means, because my whole title is Curing Heart Disease. That's the name of my website. How many people have been to my website? So only half the room. And how did you guys find out about my lecture? Did it through here? Did they have my picture or anything like that, or was it just the title?
No. I think it was the title that got his attention.
Okay. Terrific. So what I'm going to talk about is my story, and I don't know if they had that in some of the literature, but online, I'll talk about my story, how I was diagnosed, and how I overcame it. And I'm going to give some tips and tricks for anybody who's interested to convey to a loved one or for your own sake. And as far as questions go, please, I'm going to probably pause after a little while. You can ask questions. If you have something that's super important and you want to interrupt me, go ahead. That's fine. So I'm going to try to inspire, inform, and guide everybody. So my story, I think, is inspirational. I'm not the only one. I was going to go get a job about 4 or 5 years ago, and my wife told me I had to do this instead of getting a real job, because this is an inspirational story. And my wife is back in the back of the room there. Say hi, Maria. And she's been integral to this, and I have a few other friends sprinkled in here too. So I wanted to talk a little bit about curing heart disease versus reversing heart disease. Has everybody heard of Caldwell-Esselstyn? I think, is he up here somewhere? Yeah, so over there, he's got a book called Reversing Heart Disease. Has anybody heard of him? So I actually, what's interesting is I started my company about 2 years ago, and the Reversing My Heart Disease URL was taken. Amazingly, nobody picked up Curing Heart Disease. And you figure the advanced stage of medicine today, nobody bought that URL. I think the reason is that medicine is sort of, they're just trying to manage heart disease. They don't think there's a cure. And there's actually a distinct difference between curing and reversing. And I wanted to show here that Wikipedia, the source of all knowledge, says that a cure is a substance or procedure that ends a medical condition, such as medication, a surgical operation, a change in lifestyle, or even a philosophical mindset. Merriam-Webster says a complete or permanent solution or process or method of curing. And I think that curing heart disease might be a little bit of both of those right there. And then the online dictionary, medical dictionary, is to heal or make well. The important distinction about, and I kind of want to everybody get their heads around this, the difference between curing and reversing. If you actually completely reverse something, it would be in the exact same state that it was in the beginning. And where I diverge from where Esselstyn and some of the other folks that talk about this, and there's actually not that many. Dean Ornish is really, there's like 2 major guys that talk about this, but they talk about reversing heart disease. And what they talk about is when you look at an angiogram, we're going to show you some pictures of angiograms in a minute. You will see that on an angiogram, it looks like it's reversed, but physiologically, it's not reversed. And in a lot of cases, you cannot reverse a disease at all, even though you can cure the disease, which seems a little bit weird. But think about acne. you can cure acne but still have scars from it. So your acne may be cured for particularly intractable types of acne, and there are other disease states where you can be cured of something but still have scars. And I think that in heart disease, that's curing it is actually more of a goal. Reversing the process and opening up the arteries is kind of what I think the ESSES thing gets behind. And what I'm looking for and what I think I've done with myself, and I've got evidence to show this. And by the way, if you're wondering who this gorgeous little baby is, this is me. And this is me when I was very young, and I didn't know it at the time. And I didn't actually know this until very recently, but I had heart disease here. And you also notice here that I have this funny shaped foot. I was also born with a club foot, and I had to wear special shoes. And you'll see as I go through my lecture that I'm also a para-athlete. So you might have seen in the title that I'm a cyclist. I'm a world-class cyclist. I set a national record 2 years ago. It's actually a year and a half ago, calendar year, 2 years ago. And I set it in the para category, but I'm also a masters cyclist, and I got fourth at the World Championships in a Masters event as well. And here's my brother. Now, sadly, in December, my brother died of a massive heart attack. This is me. I just threw that in there. I'm like 13 years old. I thought it was a good picture. I'm going to introduce you to my mother. She died of a heart attack as well. She died in 2001. Here's a picture of the rest of my family. This is my sister. This is my father. This is my younger brother. So my younger brother died of a heart attack in 2010 at the age of 42 of a heart attack. This is my older brother, again, another shot where he just died this last year. And my sister called me to tell me my brother died, and she has severe heart disease, she told me. And so this is sort of my family history. And just for further reference, this is my stepmother here, and this is my sister's boyfriend. There's another shot of my father and my brothers. My dad was a doctor. He died in 2007. He had his first heart attack when he was 55. We went for a hike when he was 58 years old, and he could only walk about 100 yards at a time. That was 15 years before he died. He ended up in a wheelchair with kidney failure. He just had this very horrible long death. And what people forget about heart disease is that it can affect all the organs, and usually it does. It actually does. It just depends on how clinical it is. And Alzheimer's is related to a kidney failure. Chronic kidney failure, which is what he had, is also related to it. And here's my sister. You can see she's a little bit overweight. And she has not been taking care of herself. And she shared that with me when she called me. And so we're going to get into a little bit about what is taking care of yourself. What does it mean with heart disease? And I don't want to throw the medical community under the bus, but I'm sort of going to, because the information, I have a PhD in biomedical engineering, and my training was actually in nutrition and nutritional sciences. So I went to graduate school. Part of the reason I went to graduate school is to try to understand my disease and why I had the disease, or I wanted to actually avoid it because my whole family was dropping dead, and I got lucky enough to go into this program. And when I got into the program, I didn't know any of what I now know. It wasn't until I was diagnosed. So one of the things that we're going to go through here is, what do doctors look at? So they look at CT, they can do a CT angiogram, perfusion test, invasive angiography. They can do a calcium score or carotid artery ultrasound. I don't want to be too invasive, but does anybody want to share with me if they've had any of these tests? So can you tell, you want to share?
An angiogram and have a stent.
Okay. And I had an angiogram and a stent, so we're even. Do you have one or more?
Just one.
Do you want to share?
Yeah, I had some funky symptoms a couple of years ago. They did a thorough workup of me. Well, they didn't do the CT angiogram. They found nothing. So I don't know if there's anything there or not, because sometimes I get some symptoms.
Did they actually do a CT angiogram or do a calcium score?
Calcium score.
Yeah, totally different.
But there was, I take that back. They did a calcium score, but they did CT angiogram.
Did they inject the dye into you? Okay. And they didn't see anything at all?
No, everything was good.
Huh. Okay. But you still have some symptoms like shortness of breath?
Yeah, I wasn't shortness of breath, but I ended up going to the ER one night with, I was definitely feeling some pressure in the chest and some warming and radiation and shoulder and all that jazz, and high blood pressure, and it turns out I did have an infection as well. So I don't know if that was septic and that was all impacting the
Right.
symptoms or not, you know?
So you're scared, but you don't know. And those tests were clean as far as cardiac goes.
It was super clean. So basically, they did a traditional complete cardiovascular workup and it was all negative.
Okay. Well, that's good news because, if you're having a heart attack, they're really good at figuring that out usually. Anybody else want to share? No? Okay.
I don't have anything. It is high cholesterol.
You have high cholesterol. So the way that doctors, if let's say you're not having an event like the gentleman back there, the way that doctors handle your situation, generally speaking, is, and this is the way that they handled it with me, they take your family history and then they ignore it. So like my doctors knew that my parents had died and all that sort of stuff, and they never bothered to put me on a statin, and my cholesterol. Can you turn that light more toward me, Maria? It's just fell down and it's facing up. So, so for 20 years, they just let me go and didn't really look at having any further testing done. And I actually discovered my disease on my own because I had a, Maria, turn it this way a little bit. Will it turn?
We'll see.
Okay.
Hold on.
And I'll show you a little bit later, but I ended up finding out that I had, and if you haven't been on my website, and this is all on my website, but I found out that I had decrease in exercise using I had a power meter on my bike, and I was noticing I wasn't performing, I was competing, but I wasn't having any symptoms. And so I actually went to the doctor twice and tried to, explain to him what was going on, and I'll get into more of the detail later. But, generally they'll do a cholesterol test and the subfractions, like HDL, LDL, or small LDL and all that kind of stuff. They may do a CRP test, which is a C-reactive protein, which gives some more, and they can do some other sorts of stuff, and they can do composite scores like the Framingham score. But the problem with all these are, number one, is the way that they set up the tests is they were set up by committees, and the committee had to decide on what they are. And the tests actually have been shown to be quite inaccurate in a lot of cases. It's not something that I would bet my life on. I actually scored quite well on all these, and a lot of people do. And 50% of the people, their first symptom of heart disease is sudden death. And so they don't really get to talk about it much after that. This is actually me doing an exercise test, and this is how they discovered I had a problem. And I didn't even put that on here as a primary test. When I say primary testing, I guess I meant primary imaging testing. So exercise testing is actually also a secondary type of test, and they can kind of get an idea what's going on. But you sit on this thing and you pedal, and they ramp up the effort. And I've done a lot of competitions, and I can tell you, and I've seen other world-class athletes go through this test, and this is one of the hardest things you can possibly do. Maria actually had one of these tests done, and this is actually the administrator of the test. I said, I want to put this on video. Can you videotape me? I was really working. The test was already over here. But it's called the VO2 max test. Athletes get it done to see what their VO2 max is and see how strong they are. And my cardiologist is Dr. Rory Weiner at MGH, and he actually has a lab where they can do this, and he was going to put me on a standardized test which is a treadmill, and they usually take you up to about 60 or 70%. They don't take you up that high on those tests, and for an athlete it may not show. And interestingly, it did not show me having a problem until I got into the 90% of my VO2 max, which is a rate of exercise that I would do at the finish of a long race. I mean, it's like a very extreme. just to let you know, I got third at the regional time trial championships the year I was diagnosed, and I got a bronze medal, and I had 2 65% blocks in my cardiac arteries, and they stented one of them. And we're talking on producing 300 watts of power, which if you've ever been on an ergometer or whatever, the average person can do about 75. So this is like way out there, and then my heart was riddled with lesions. So you can have very severe heart disease and asymptomatic, and this is part of the problem. They can do the cholesterol test, and you can be asymptomatic until you're symptomatic, when 50% of the people die the first time they have a symptom, and the other 50% they get lucky and they may have some angina, which is some chest pain, and usually you're up around 90%. And I actually run a group out of my house and some of my group members are here that are sprinkled throughout the group, but we have one of our group members had 2 90% blocks and was walking around like nothing was going on. He's 75 years old, and he started to do high intensity training, HIT training on an ergometer, and he started having some chest pain with 2 90% blocks, and he had 3 70% blocks. And so the problem with cardiology is they don't know this. They don't do routine imaging. If you had a tumor growing in your breast or anywhere on your body, or you had something pressing on you and they did an image, they would continue to treat you and image it to see how well you're improving. Cardiology doesn't do this. And it's actually quite fascinating because they're sort of in the dark ages. And when you have an issue, and this is what happened with me, I had I had this test done, and he gave me 10 milligrams of pravastatin, which is a statin, and sent me home. Now, when I first went in 2 years before, I thought I had a problem, and he said, your blood looks good. He didn't test me, and he sent me home. And it wasn't until I started really seeing that my ergometer wasn't lying year after year, it wasn't getting any better. I hired a couple of coaches, and I wasn't improving. I went back in, and I had that test done. Now, what I want to show you here, this is a really funky-looking graph, I know, but you could probably see I got these red lines in here, and some of them are pointed up, and it's the way that these are ECGs configured throughout when I was first diagnosed, and then subsequently after. This is after I had my stent put in. Horizontal is bad, okay? So these are horizontal. So this means that I have ischemia, and these are different leads on an EKG, right? I have one good one, which is upsloping. Upsloping is good. This is when I first went in. This is when I went in and had 3 months after my stent. I had my stent put in late September of 2014. So I was all excited to go back in because I thought, I'm just listening to the doctor. I have a PhD, but I'm going to MGH, and they put a stent in me, and I'm going to be awesome, and I'm going to go back to competing at a high level. And I go in, and I'll show you, I think I have a chart later in here, that I go back in, they're all horizontal again. And actually my exercise test went down. I was training for the test. And it's December, it's the off season, but I was killing myself training really hard. So they're all still, he's like, oh, you still have ischemia here. You're still not looking good. So it was about that time that a friend of mine gave me Carl Esselstyn's book, and I read it, and I'm a scientist, and I'm like, I'm not going to listen to anybody. Started reading all of the original research, and this was the pathway I went on. And I didn't want to go vegan. I didn't want to go low fat. I didn't want to go whole food, plant-based. I liked hamburgers. We actually just moved. My realtor gave us a grill, and we were literally grilling hamburgers twice a week because I read all the data. I had a PhD in nutrition. I knew what I was talking about. There was a big review in one of the biggest journals in nutrition that showed saturated fat really didn't matter. So I was eating my hamburgers. And that was the result right there. So I think it was about February or March of 2015, Maria and I just decided I've read enough. I cannot eat any more meat. And we just shut it down. I actually was really hungry for about 3 weeks. I didn't even know what to eat. I just knew that the literature was clear. This was the result after. They're almost all upsloping. As a matter of fact, this one doesn't even count because if there's only one, it has to be on 3 different leads. And that year, my VO2 max went up 15 points. If anybody knows what VO2 max, it was 65, 66 milliliters per kilogram. That's what elite marathon elite 30-year-old marathon runners have. And that's when I sort of discovered, I had this hidden secret that I was actually world-class on paper, but I was barely doing very well in the local races, and I'll get to that later. I found out when I started going for the world record that I had to train a lot harder. And then what's interesting is that you see here we got a whole bunch more horizontals, and then we got some upsloping year to year. So what's happened is that what we think is going on is that all my arteries are clear except one, and that one is sort of just barely on the cusp of being ischemic or showing these ischemic signals. So I'm not 100% reversed, but we think that I'm actually cured. This is the graph that I produced to show that my power was dropping. So you can see 2009. Now, when you age by about 2% per year in terms of your power and your VO2 max. This was a 15% drop in about a year and a half. And so this was just not a very, this was a terrible indictment as to where I was going. So my pointer just burned out here. I'll use this pointer. Actually, I'll use a laser pointer. There we go. So you can see it's like, you know, if you're competing, which I was, this is not too good here. So you don't want to be there. This is actually a picture of my heart. This is a CT angiogram, and you can see there's a little bit of a divot in here. What was funny was because I was having these alternating years of ischemia, remember I had no symptoms and my power was getting better, but I was still having a little bit of that signal on the EKG, and my doctor refused to do an invasive angiogram because they have to stick a needle in your arm, thread dye into there, and then inject you, and he said it's too risky. So let's do a CT angiogram. I said, I don't think they're as accurate. So I started reading some papers because, you know, I'm doing this full time. I took off from my job that I spent literally 3 or 4 years trying to heal myself. And he says, no, go ahead and do it. So when the results came back, I had a 92% block. And then he starts to panic, and then they ended up doing the invasive angiogram, and it showed all my arteries were clear. And I think I have that picture right here. And there we go. Oh, yeah. So now what this is my angiogram, and I'm actually going to step because it's much easier if I just walk right here and turn my back to my camera. But these individual segments here are the exact same length between the two, and both these images are calibrated to be the exact same size. And how do I know that? Because this is the catheter going in. It's a 1.5 millimeter diameter on both. I use the same exact measurement on each one, and actually there's a group in Houston that's working on this. They switched over the software. They're going to do it officially. The same guy that did Dean Ornish's work is going to quantify this by an exact millimeter. But you could see right here, this is my first one when I was diagnosed, and you can see here, can you see the difference? That's probably the most remarkable difference you can see, that it's much wider on the right-hand one. But all these other ones too, you can see here very closely that red line is extending beyond. So remember, the lines are identical length, right? And you can see here that the line is flush with the side of the artery. So this artery is actually bigger. That one wasn't even annotated in the pathology report. And all the rest of these, if you were to, and this is on my website, curingheartdisease.com, you can run the video and stop it and look at it closely if you care. But all the arteries were bigger except this one, which is called the second diagonal, and we think that's the culprit artery right now. It's about the same. Okay. Now, any questions? So now we can stop and take questions. No? Sure, I know there are questions in there brewing. So this is the carotid artery ultrasound. So in this right here, you can see that this is the artery in your neck, and I have a little plaque there. But there's nothing really blocking this, and that's just a natural contour there. It was noted as minimal plaque, minimal thickening, but yet I had all these in my heart. So if you ever have a neck ultrasound, a carotid artery ultrasound, they're not indicative of what you're going to have in your heart. And so it's a little bit tricky. And I had this done afterwards because there's a group in Canada that designed the ultrasound. Apparently they do it completely different. I had 4. I was like, because I'm trying to reverse and cure my disease. So I had 4 of these done, and it's impossible to tell unless it's done with a particular type of calibration. So this did not serve me as well as the angiogram. So I had these done before the second angiogram. So the angiograms were 4 years apart. But this group in Canada, what they do is they aggregate all these little lumps in there, and they aggregate them and they combine them. They give a total composite score, and then this guy's been doing it for 20 years, and he's got all this stuff published. And what they can do non-invasively, it's not telling you what's in your heart, but it's telling you if the treatment that you're doing, whether you're doing meditation and the whole food plant-based and all that sort of stuff, and they can go in there non-invasively, put an ultrasound probe on your neck and measure if the disease is actually regressing. Otherwise, remember, it's all about what is your cholesterol? What's your cholesterol level? And how many people have gone in and said, oh, your cholesterol looks good, it's 180, your LDL is 120. Your LDL, for you to be reversing the disease, needs to be around 50, not around 100. And so what's so interesting about this, and I talk to people about this, is that, your doctor will probably be retired or dead by the time you get heart disease. It's a lifelong disease. It happens throughout your entire life. So here's a cool little video. So this is what a stent looks like, in case you haven't had one or didn't care. There's a 5th generation now that are dissolvable stents. You probably heard about that. And the notion about these stents is that they prop open a pipe, right? And it's supposed to help. Well, it turns out that your arteries are not pipes. They're biological systems, and they have abilities to expand and contract. And it does this through muscle contracture, which the large arteries around the heart are actually muscular. And they have their own separate blood supply. It's called the vasa vasorum. And interesting, if you ask your cardiologist and say, how is plaque formed? And just basically, you'll say, well, you have this cholesterol in your blood, and it diffuses into the side of the artery, and it goes into the enema, and that forms plaque. Well, actually, I would say probably 80% of cardiologists don't know, maybe even 90%, but actually the plaque is formed from the blood supply that goes to the artery. In other words, you have, it's not pictured here, little capillaries that are feeding the muscle, because these are the large arteries around your heart. And your arteries are so thick and muscular, they need their own blood supply that's not just from the blood going through the lumen. So the cholesterol actually sneaks in through the backside. This is the imaging that they use. And that's what you look like when you're on the table.
That didn't go well.
That's what they look like. And a lot of these arteries aren't that big. The biggest ones are 5 millimeters in diameter. So the bigger they are, probably the better. I had mine in my right coronary artery. So we're going to go through a little bit of a lesson here, because I think this is important for everybody. And I love biology and pathophysiology, but it's like so important to understand. This is the muscle area here. It's called vascular smooth muscle. These cells proliferate and assist in making a plaque. But you have this one single layer called the endothelium. And the endothelium lines your arteries all over your body. And you can actually spread out and make 2 full football fields out of the endothelium in your arteries. So the endothelium is akin to your epithelium, which is the skin layer on top of your on the outside of your body. So these endothelial cells actually are very magical, and they have significant properties that stop blood from clotting.